Hello, I'm Dr. Andrew Sinclair. I'm a health psychologist who works at Independence Australia and have worked with polio survivors and people dealing with the late effects of polio for over 10 years.
And hello, I'm Jenny Coadlo. I also work at Independence Australia as a clinical psychologist. And not only do I work with people with disabilities, I also have been working with family members and the social effect that the disability can have. So for polio survivors, changes in the way their body looks and functions can affect the way they think and feel. And further weakness and fatigue may also affect their mobility and independence that they work so hard to achieve, causing significant feelings of grief and loss. And this may also remind them of traumatic experiences from their childhood battle with polio. And due to their desire to be independent and get on with life, they may not talk about their feelings because they don't want to burden those around them.
For people with polio experiencing a decline in physical function, there's a range of common emotions they might experience. One of the earliest one is often denial, or where we minimise the changes that are happening and the impact on our life. And that can be a useful coping strategy when we're first confronted with change. But if that persists, it may get in the way of us making the changes that will help us to adapt well to the change in our physical condition. Other common experiences can include anger or even blame, and that may be blame of ourselves or others and family. And sometimes that's related to our early experiences of polio when we were a child. Another common experience is guilt, and that can be around how our physical function impacts on our valued roles in our life, whether we can be a good parent or partner. Finally, sadness is a really common emotion, and that reflects the loss of function and perhaps a sense of self-esteem that comes along with the decline in physical function. If, because of that sadness, we start to avoid interactions with others, then that can contribute to the development of depression, which is a significant concern for people with polio.
It's important to realise that when we have a loss of function, some illness that goes on for quite a while, we often experience loss and hence sadness, a sense of sadness. And this is understandable and actually useful, as long as we don't get stuck in it. The thing that can also make it harder is that it can trigger earlier loss, earlier feelings of pain from our childhood, and this can make the whole thing a bit more confusing and distressing.
To emotionally cope well with increased limitations, people with polio may have to make important and realistic value changes about what is important to them in their life. People who cope well with change focus on what they can do rather than the function that they've lost. They take an active management strategy. They may look at options to participate in new areas in life, to adapt to the change well. So they may have problems, but they're not overwhelmed by them.
So some helpful tips are things that it's important to recognise our emotions, that they're activating, they're about us, it's about releasing those emotions, not getting tied up in them. And to not have to go off on your own, like, to lick your wounds on your own in your own bedroom to cry. It's letting it out with people who you know, love and care, your friends, your family, and hopefully a support group that you've managed to connect up with.
And effective problem solving is also really helpful to get back to a valued life. Solve problems around changes in your physical function by looking at how your house is set up or using assistive devices, but also in your social environments by engaging in new valued activities or social groups. Appreciate the accomplishment and the things that you do rather than focus on what you may have lost or how you used to be able to function. But sometimes it's helpful to seek professional support. If you visit your GP, you can access a psychologist through a mental health care plan.
And again, I'll stress the importance of connecting with family and friends and looking for a polio support group.